All right, well, if you are a new parent, like our director Nick, for instance, there are a lot of challenges that come with the first few years. Whether your child is up crying all night, has acid reflux, or ear infections, there may be an easy way to get them some help. And joining us this morning to talk all about it are Dr. Skip and Julie Weiss of Green Bay. Good morning, guys.
Good morning.
First off, for those who don't really know what you guys are all about, can you just give a short little background on you guys?
Sure.
We are pediatric chiropractors, and lots of times people don't exactly know, oh, my child should see a chiropractor. Sure. You have to get a bachelor's degree first, and then you continue on to graduate school. So for the schooling, it's the same as a medical doctor, and then after, when medical doctors typically do a residency, then we go on to either open our office, associate, basically go out and help the community.
Very cool. Well, before we dive in talking about problems with your kids, we do want to talk about pregnancy. Now, for women who have a difficult time getting pregnant, you guys may have a solution to try to help. Is that right?
Yeah, absolutely. Infertility is a major problem going across the nation, period. About 40 to 50% of women have problems with infertility, and the average American actually on even given time can actually only get pregnant about 20% of the time during the month. Okay. I mean, so it's very low. Chiropractic can offer a very amazing solution for that, and just making sure that the body is properly talking to itself. You see, the brain runs the body, and as long as the brain can effectively communicate to basically every nook, cranny, and cell of the body, it should be able to run the program it's been designed to run, very similar to a computer talking to a monitor.
Okay.
So as long as the brain's properly able to talk to the uterus, it should be able to give the body every ability to ovulate and conceive. But unfortunately, sometimes when women are subluxated, which is a misalignment of the spine, that'll interfere with how they can ovulate, move eggs, get pregnant. That'll have a majate problem with it. So chiropractic can aid in that and hopefully help along, give the woman the best chance of conceiving.
That's some great advice. Okay, well, so if you're trying to get pregnant, maybe give these guys a call, do a little adjustment on you. Let's talk about kids. Now, some kids have colic, they have ear infections, they're up all night spitting or crying. You think this can actually help them, right? By getting a little adjustment? Okay.
Absolutely, yeah. I mean, it goes back to, so congratulations, you're finally pregnant.
Yeah.
But if you think about that little baby inside your abdomen, in that uterus, there's not much room for them to move around. And so already during pregnancy, there's constraint on that baby. And so then you go to the birth process, which I wouldn't want to do it again. It's not easy.
You've had two, so.
It's not easy for that little one. And so, you know, already that child is facing so many obstacles, so many different misalignments that's happening in that spine.
And this doesn't hurt them, right?
No, absolutely not. We see children all the way from our youngest child that we adjusted is 8 minutes old, and that was my son. And usually we see children within the first 24 hours to 3 weeks to 4 weeks to 5 weeks, depending on what's happening with the child. A lot of the times it comes from the birth process, and that's why seeing a chiropractor throughout pregnancy is incredibly important as well. Because you need to picture the uterus as a hot air balloon, and it's tethered to your pelvis, which is the basket. And if there's a twist in that basket where there's a misalignment of that pelvis, it's going to twist a hot air balloon, right? And if that air balloon can't inflate properly, nothing can move around in there. So if there's a torque or a twist in that pelvis, the air balloon can't move, and now the baby will get constrained, and then they can have a head underneath their, they can have an arm underneath their chin, or they can have a foot coming out and have like a footling breech, or they can be full breech, and the baby can't move properly. And from that point on, that's what can subluxate that baby. Now, then they can have colic, they'll develop colic, digestive issues, they can develop bedwetting, constipation. These are all problems. See, chiropractic is basically evolved so much from just the back pain, headache realm. In children, they can't tell you that they're not feeling good. The only way they can do it is cry. And when I have a parent that comes in, it breaks my heart that they haven't had sleep for 5 or 6 or 7 weeks, and the only realm they can go down is giving some sort of antacid to the child or something to help their stomach, when it has absolutely nothing to do with that. And unfortunately, our medical colleagues have their hands tied because they're only given so much to help that child out, and usually it's drugs or surgery. And chiropractic can help so much more, because it allows that baby to heal and become healthy. All
right. Well, I have to cut you guys short because we are running out of time, but we're going to put your information up on our website. If you guys have any questions, just go to NBC26.com, and we'll be right back.